Heart disease remains the leading cause of mortality worldwide, but for many seniors, the first warning isn't a sharp pain. It's a subtle, silent shift in daily function. Clinical studies confirm that nearly half of all heart attacks are silent, occurring without obvious symptoms and often leaving behind significant, unaddressed tissue damage. I'm Dr. James. Today we begin our investigation into the 5 silent signs your heart needs medical attention. We start with a symptom often dismissed as simple aging: unexplained fatigue. When the heart struggles to pump sufficient oxygenated blood, the body's primary response is profound exhaustion, even after routine activities like climbing stairs or a short walk. Statistical evidence indicates that persistent, non-exertional fatigue is a primary clinical indicator of declining cardiac efficiency and potential heart failure in the geriatric population. Early detection of these subtle physiological changes is essential for maintaining cardiac longevity and independence. Often mistaken for a lung issue or lack of fitness, persistent shortness of breath during routine activity is a critical indicator of declining heart function. Clinical data reveals that when the heart's left ventricle fails to pump effectively, fluid backs up into the lungs, creating a state of chronic respiratory distress. I'm Dr. James. This symptom, known as dyspnea, frequently worsens when lying flat, a condition that data suggests is a primary predictor of underlying congestive heart failure. If you find yourself needing to prop up on extra pillows at night just to breathe comfortably, your body is providing a statistical warning that your heart requires urgent clinical evaluation. Factual evidence confirms that early diagnostic testing, such as an echocardiogram, can identify pulmonary congestion before it leads to an acute cardiac emergency. Addressing these subtle respiratory shifts is a fundamental requirement for maintaining long-term cardiovascular health. Often dismissed as a side effect of long-standing or heat, persistent swelling in the legs, ankles, or feet, known as edema, is a significant clinical marker of heart failure. Clinical data indicates that when the heart's pumping power weakens, blood backs up in the veins, forcing fluid into the surrounding tissues through increased hydrostatic pressure. I'm Dr. James. This accumulation is gravity-dependent. If you notice your shoes feel tighter by evening or that an indentation remains after pressing your skin, your heart may be struggling to maintain systemic circulation. Sudden weight gain, often several pounds in a single week, accompanies this swelling, representing the statistical warning of an impending acute cardiac event. Factual evidence confirms that daily weight monitoring and early diuretic intervention can prevent hospitalizations by identifying heart failure exacerbation in its earliest silent stages. Recognizing the data provided by persistent edema is a fundamental requirement for proactive cardiovascular management in later life. While often attributed to dehydration or inner ear issues, frequent spells of dizziness or lightheadedness are often the body's early warning of a struggling heart. Statistical data reveals that heart rhythm disturbances, or arrhythmias, are a primary cause of reduced blood flow to the brain, manifesting as sudden, unexplained instability. I'm Dr. James. When the heart fails to maintain a steady rhythm, the brain is momentarily starved of oxygenated blood. This isn't just a dizzy spell, it's a critical sign of cardiac electrical dysfunction. In adults over 60, this lack of stability significantly increases the statistical risk of traumatic falls and syncopal episodes, which can occur without any prior physical exertion. Factual evidence confirms that prolonged cardiac monitoring can identify these intermittent arrhythmias before they lead to a total loss of consciousness or a catastrophic stroke. Identifying the underlying cause of persistent dizziness is a fundamental requirement for maintaining long-term cardiac safety and independence. One of the most frequently ignored warnings of a cardiac event is persistent nausea or indigestion. For many seniors, the heart signals distress through the digestive system. Data confirms that nearly 1/3 of heart attack patients, particularly women and those over 60, experience no chest pain at all, reporting only severe gastric discomfort. I'm Dr. James. This overlap occurs because the heart and the upper gastrointestinal tract share the same neural pathways. The brain can often struggle to distinguish where the signal of ischemia is actually originating. When cardiac blood flow is restricted, the resulting referred pain can manifest as a persistent burning sensation in the stomach or an unexplained bout of nausea that doesn't respond to antacids. Statistical evidence shows that mistaking these silent signs for simple indigestion is a leading cause of delayed treatment, significantly increasing the probability of permanent heart muscle damage. Recognizing the link between gastric distress and heart health is essential for proactive and life-saving cardiac intervention. While heart disease is frequently perceived as a male condition, the data reveals a far more complex and dangerous reality for women over 60. Statistical evidence shows that women are 50% more likely to receive an incorrect initial diagnosis following a silent cardiac event compared to men. I'm Dr. James. In women, the heart often signals distress through non-traditional pathways, making symptoms like jaw pain or localized back pressure critical clinical indicators. This physiological difference often stems from microvascular disease, damage to the tiny vessels that are frequently missed by standard screenings focused only on major arteries. Clinical registries confirm that gender-specific screening is essential to identify these silent signals before they result in catastrophic and permanent heart muscle damage. Understanding the unique cardiac risks for women is a vital requirement for effective medical intervention in later life. For millions of seniors, the most significant threat to heart health occurs during sleep. Obstructive sleep apnea is a silent driver of chronic cardiac strain that often goes undiagnosed for years. Clinical data reveals that severe untreated sleep apnea increases the statistical risk of cardiovascular mortality by threefold, primarily through the mechanisms of nocturnal hypertension. I'm Dr. James. Each time breathing stops during sleep, the heart is forced to work harder against a closed airway, causing acute spikes in blood pressure and damaging the delicate heart muscle. This intermittent oxygen deprivation triggers systemic inflammation and oxidative stress, which accelerate the development of coronary artery disease and irregular heart rhythms. Statistical evidence confirms that treating sleep apnea significantly reduces cardiac load and can effectively reverse certain types of drug-resistant hypertension in the over 60 population. Recognizing the link between respiratory health and cardiac stability is essential for preserving long-term heart function. For those with a history of high blood pressure, a sudden, unexplained drop into low readings is often misinterpreted as a sign of health improvement. However, data suggests this is a dangerous clinical paradox. Clinical registries indicate that when a chronically hypertensive heart begins to fail, its pumping power decreases so significantly that it can no longer maintain the high pressures it once sustained. I'm Dr. James. This shift, known as burned-out hypertension, occurs when the heart muscle becomes too weak to generate adequate force, representing a critical transition into advanced heart failure. Instead of a sign of recovery, this normal or low blood pressure can be the final silent warning that the cardiac system is entering a state of decompensation and systemic instability. Factual evidence confirms that immediate clinical consultation is required when blood pressure drops without a change in medication, as this often indicates the need for advanced cardiac support. Understanding the data behind the hypertension paradox is essential for identifying heart failure in its most deceptive, silent stage. Atrial fibrillation, or AFib, is a cardiac rhythm disturbance that often remains undetected. For those over 60, this silent flutter in the chest is a primary indicator of structural heart disease. Statistical evidence shows that untreated AFib increases the risk of ischemic stroke by 500%, as irregular heartbeats allow blood to pool and form dangerous clots. I'm Dr. James. Because AFib can be intermittent, standard EKG tests in a doctor's office often miss it. This paroxysmal nature is what makes it a truly silent and deceptive threat. This electrical chaos prevents the heart from pumping effectively, leading to a progressive weakening of the cardiac muscle and a significant decline in systemic blood flow. Factual evidence confirms that prolonged wearable monitoring can identify silent AFib early, allowing for medical management that reduces stroke risk by over 60%. Detecting heart rhythm irregularities early is a vital requirement for preventing catastrophic cardiovascular events in later life. The absence of pain does not equal the absence of danger. Silent ischemia is a condition where the heart muscle is starved of oxygen without ever triggering a single warning signal in the chest. Clinical studies confirm that patients with diabetes are at the highest risk, as nerve damage, or neuropathy, blunts the body's ability to perceive the intense pain of cardiac distress. I'm Dr. James. This silent damage can lead to sudden heart failure or a massive unforeseen attack because the underlying coronary artery disease progressed entirely without symptoms. Statistical data reveals that silent ischemia accounts for nearly 70% of all ischemic episodes in the geriatric population, slowly eroding cardiac function over several months. Factual evidence confirms that proactive screening, such as a nuclear stress test, is the only way to identify these silent blockages before they manifest as a catastrophic life event. Identifying the invisible markers of heart disease is a fundamental requirement for cardiac safety in our later years. The heart and kidneys operate in a precise high-pressure loop. When one begins to fail, the other inevitably follows, creating a silent cycle of systemic decline. I'm Dr. James. For seniors, declining kidney function is often the first silent signal that the heart is no longer pumping with enough force to maintain vital organ perfusion. Clinical data identifies cardiorenal syndrome as a primary driver of emergency admissions, where heart strain leads to acute renal congestion and fluid overload. As heart efficiency drops, the kidneys receive less blood flow, triggering a hormonal response that forces the body to retain salt and water, further stressing the heart muscle. Monitoring markers like BNP and creatinine is not just about kidney health, it is a data-driven window into your heart's performance. The evidence demands early intervention. Recognizing the link between renal function and cardiac output is essential for maintaining systemic stability in later life. Throughout this investigation, we've examined how fatigue, shortness of breath, and nausea serve as the body's hidden signals of cardiac distress and structural heart disease. I'm Dr. James. Modern cardiology is shifting from reactive treatment to proactive prevention. Early identification of these silent signs is the key to preserving heart muscle and independence. Advancements in wearable monitoring and blood marker analysis now allow for a personalized safety profile, identifying risks long before a catastrophic event occurs. Factual evidence confirms that 70% of sudden cardiac deaths are preventable through the early detection of the underlying conditions we have explored in this series. The data is clear. Vigilant self-awareness is your most powerful defense. Take care of yourself because your health is truly your greatest wealth. Knowledge is protection. The investigation into silent heart signs concludes, your data remains your best guide.